So good afternoon. Today's webinar will be starting shortly. Please join us in our interactive word cloud to describe one word that the HCN and PCA partnership has done for you during COVID-19. We'll be collecting your responses throughout today's webinar, and the webinar will be starting shortly. Good afternoon. The webinar will be starting shortly. Today's live word cloud interaction, you can take out your cell phone and type in the two-line 22333 and put in the word in the text message, COVID-19 heroes, and you're all set to participate. And today's question is, share one word to describe your health center controlled network and PCA partnership during the COVID period. We'll be collecting these responses throughout today's webinar, so please join us. The webinar will be starting shortly. The webinar will be starting shortly. This is preparing communities for COVID-19 and beyond. And as we wait for others to join today's webinar, please join our live word cloud. Take out your cell phone and type in 22333 in the two-line and put in COVID-19 heroes in the text line. And then share one word to describe your health center controlled network and PCA partnership during this COVID-19 period. Please join us, and we'll be looking at the word cloud throughout today's webinar. And today's webinar is on preparing communities for COVID-19 and beyond, networks connecting health centers. Thank you to our healthcare heroes during this COVID period. These are some pictures of many staff from health centers across the country. Please send us your photos and we'll place them in one of our next upcoming webinars. This one, Preparing Communities for COVID-19 and Beyond, we have networks connecting health centers together. However, we are forever grateful for our community healthcare heroes. The webinar will be starting shortly. And join us in today's interactive portion of our webinar. Get out your cell phone and type in 22333 in the to line of your text message, and then put in COVID-19 heroes, and you'll be all set to join us in, share one word to describe your health center controlled network and PCA partnership during COVID-19. The webinar will be starting shortly. Our webinar will be starting shortly, but please join us in our live word cloud during today's webinar. Share one word to describe your health center controlled network and or PCA partnership during COVID-19. You can take out your cell phone, put 22333 in the to line and COVID-19 heroes in the message line, and you're all set to participate. The webinar will be starting in just a moment. The webinar is going to be starting in just one moment, but please join us for our interactive portion. Take out your cell phone and type in 22333 and put in COVID-19 heroes in the message line, and share one word to describe your health center controlled network and PCA partnership during the COVID period. And our webinar is going to start in 30 seconds. So good afternoon, everybody, and welcome to Health Choice Network and Alliance Chicago in Action, preparing communities for COVID-19 and beyond. Today, we're going to be talking about how networks connect other health centers. And with networks connecting health centers, we're going to hear from our partners across the country, within health centers, within state PCAs, and also our national partners. And first, we're going to start off with our first slide. And there's going to be a little bit of a delay advancing the slide. And hopefully you were able to join us in our word cloud that we will be showing throughout the webinar. And you can type in 22333, put in COVID-19 heroes, and tell us one word that describes your partnership with your Health Center Controlled Network and PCA during COVID-19. And for today's webinar, we're going to get an overview of Health Center Controlled Networks, our history, our partnership, and then collaboration in action. Next, we're going to hear from the federally qualified community health center perspective, and we're going to hear from 3 CEOs from 3 nationally known community health centers across the country. Next, we're going to hear from our national partners, both at HRSA and at the National Association of Community Health Centers. And finally, we'll hear from our state-level partnerships. So first, as we go through today's agenda, I want to make sure that everyone is aware we're going to record today's session. You can put questions into the chat, and we will try to answer them at the end of the session today, or we will be able to collect those questions and send them out later. But first, we're going to hear from our Health Center Controlled Network partners. And Dr. Fred Rockman is the CEO of Alliance Chicago. Fred, are you with us today?
I am, Tim. Can you hear me?
Yes.
Great. Thank you. So I'm going to start us off with first a brief orientation overview of the history of Health Center Controlled Networks, and then a little bit about Alliance. So could we advance the slide, Stephanie, please? I'd really like to dedicate my remarks today in memory and recognition of an individual who is one of my most significant sources of personal inspiration and motivation. And without his work and contributions, arguably none of us would be on this call today, nor would we have accomplished the things we have together. Next slide, please. For those of you who did not know Betsy, or have the opportunity to experience firsthand the power of her leadership and influence, Betsy was a clear, tireless, and visionary advocate for the mission of our health centers, and she was one of the thought leaders who developed the concept of what we now know as the Health Center Controlled Network. Next slide. Shortly after I entered the community health center scene, the Bureau of Primary Health Care partnered with the Institute of Healthcare Improvement to launch the Health Disparities Collaboratives. The model aimed to rally our health centers around implementation of evidence-based practice and to share our resources and brainpower by working together on common objectives. The model entailed group sessions, next slide please, interspersed with periods in which health centers tried practical approaches. You just need to keep advancing, it's going to unfold, thank you. And some of the experiments worked, some of them didn't work, but in these learning sessions, we were able to share both the successes and the failures. And by doing that, we were able to make amazing progress in relatively little time. Next slide, please. It was tremendously successful. And being part of a national movement was very powerful for me as a young clinical leader. It reinforced the power of working together, the importance of shared goals and measures, the necessity for large-scale data, the need for finding ways to share scarce resources, and our ability to do things with more impact and sophistication if we worked at scale. It was this experience that set the stage for the emergence of networks. Next slide. Do any of you find it remarkable that while we have more clinical sites, more clinical staff, and serve more patients than any other group of practices, next slide please, we're poorly recognized and never appear on the list of largest health systems in the United States, and yet we are the largest. Next slide. Betsy Cook and a group of leaders in Southern Florida asked that question and realized it was because while our independence as health centers dedicated to specific communities is critical to make what makes us unique and effective, It also limits our ability to accomplish things that require scale. They recognize that in an increasingly competitive environment that favored size and market strength, we needed to do something different. The idea, as elegantly brilliant and simple as the paperclip, was that health centers come together to establish infrastructure to carry out things as a group, much like a large health system, but to do this through a governance structure that retained the independence and control of the individually participating health centers. Next slide. So as a result, we have the emergence of modern health center controlled networks as we know them today. And this quote from the Bureau underscores how uniquely positioned we are to help health centers navigate the complex environment we find ourselves in today. Next slide, please. I'm going to pivot now to talk about the history of the Alliance. Inspired by Betsy Cook and the work at Health Choice Network, we gathered together a group of leaders that includes Bernice Thomas, who you'll hear from today in Chicago, to found a network in Chicago that was then called the Alliance of Chicago Community Health Services. Next slide. Our mission was to improve health at all levels, personal, community, and public health. And arguably, our activities reflect our efforts at all of these levels. We started with a visionary goal for health information that followed on our experience with the health collaboratives. It was that health information be patient-centric, it be timely and consistent, that it glued together the disciplines that we have to offer as a health center, that it prompts evidence-based decision-making, not only by us, but by our patients, we have population-level data to participate in the advancing of medical knowledge and strategy, and that we're transparent about the information. Next slide. Our activities have emerged to focus in three main areas: health information technology and all that pertains to those, the availability and uses of information that I just described; healthcare collaboration, referring to a variety of activities that we use to bring together health center staff and clinicians to leverage technology to transform how we do care; and then a particular focus on the use of data for research and learning. Next slide. We now touch more than 60 safety net health centers, more than 3 million patients. We're engaged with more than 20 funders and have more than 20 academic research affiliations. In terms of COVID, we've leveraged this information from the beginning. First of all, beginning from data, tracking data and what's happening at our health centers, and then partnering with Health Choice in these listening sessions to understand what we're learning as groups of health centers and try to aim at leveraging our resources to support that. These next few slides give you an example of the data and show some of the responses that it has shaped. So first of all, that first slide showed the testing that we're doing and how we're looking at those patterns to understand disparities, the scale, and the potential role that the health centers could play. We're looking at symptoms which go beyond the test to understand, begin to understand the unfolding of the disease. Next slide. We've been tracking visits and the conversion to virtual visits, both to understand what's needed in terms of delivery, but also to help with health centers make sure they're capturing data in a way that will feed reimbursement and learning around that. And next slide. More slides on disparities. Next slide, please. And this is where it really gets exciting. Using the data at scale to begin to present system-wide views of the data. This is tests in the next slide. Pockets of positivity graphed by geography that really illustrates how we coming together as a system can be part of a nationwide surveillance and disease management and learning community. So with that, let me turn it over to Alex.
Great, thank you, Fred. And I think Alex is with us. Alex, can you hear us?
Good afternoon, Tim. How are you?
Great, thank you.
So if we can go to the next slide, please. So good afternoon, everyone. Thank you for joining us again on our 9th webinar series. I appreciate the opportunity to share with you our focus here at Health Choice Network and the partnership that we've established with so many PCAs and HCCNs across the country, but specifically, as we call it, our sister network, the Alliance Chicago, because Betsy really was the architect behind this process. Right now, we have 3 underlying values that drive our mission, and our mission is pretty simple, is to make sure that we provide the affordable infrastructure for our health centers so they can do what they do best, which is serve the community. And as they've pivoted so many times throughout the history of the F2HCs, looking at the pandemic and what they've done has really inspired us at the networks to make sure that we have the tools, technology, and services to support their every move throughout this journey. Next slide. So in 2016, our board of directors, which is made up of the CEOs of health centers, said the return on investment of Health Choice Network in technology, group purchasing, network contracting, managed care, and revenue cycle management is not enough. We need to be the best in the quality eyes of our #1 funder, which pivots between the Bureau of Primary Health Care and their state Medicaid offices and their managed care opportunities. So we started tracking not only the goals of the health centers individually, but also from the Bureau of Primary Health Care. And we're very proud of the work that we've done since 2016. We are held accountable at Health Choice Network. Every move HCN does, whether it's our investments, our staff growth, our opportunities for advancement, are all tied to our health centers' goals. So for us, we are tracking every single item the Bureau puts out. And also, we're also tracking the local markets. So if there's our HEDIS goals or ACO goals or PSN goals for their managed care environment, that drives how Health Choice Network is able to move along the journey of supporting our health centers. And I can guarantee you, since 2016, it's changed significantly. We went from a very focused area of HEDIS to now focusing specifically on access. And we were working on telehealth for the last year. And of course, we had to pivot very quickly to support that model. Next slide. One of the things that makes HCN unique is, as Fred mentioned, Betsy was the architect of the HCN movement with some of the folks on the phone today, Dick and the folks from the Bureau and NAC. But being the first health center control network back in 1994, we made a lot of assumptions and a lot of mistakes. And we've tried to share our journey with all the networks and PCAs so that way we can move faster and be there for our health centers quicker. I can tell you in 1994, we were the first driven managed care contract in the state of Florida. So we were taking risks in the Medicaid space on behalf of our health centers. And many of our CEO partners looked at us like we were nuts just because the data wasn't available to us. And the fact that we started collecting data and looking at how health centers can play a critical role in the face of the state agencies as a critical partner really drove us to our third major goal, which is the ROI and how we drive that ROI. Our budget, our goals, and everything is done during our annual planning session with our health centers. And what's interesting, that has generated 2 separate organizations, Prestige Health Choice, which to date was the largest revenue generator for health centers in the country, and our new ACO that's been now in place for 6 years. These are all items that have been done to be able to bring revenue and justification of the quality health centers provide in not only our state, but across the country. It's interesting because our board always says that we have to have the best associates here at Health Choice Network to help advance the health center movement. So our values are pretty simple. It's driven behind service excellence, the innovation. Fred talked about innovation, the fact that Fred and I got together so many years ago and figured out who does what best and how we can partner together and what are the group investments that we should be making on behalf of our health centers. Empowering our health centers to be not only unique and stand alone, but also be part of a network of sharing and collaboration. Our commitment to their mission, HCN's mission, is all driven by the health center's mission, and the advocacy, working alongside our PCA partners, our health center control network partners, and the Bureau partners. And we're really proud of the fact that many of our CEOs quote out the fact that the work HCN does behind the scenes is what's driving their mission and the ability for them to thrive in their market space. Next slide. And as we started looking at hiring the best and looking at the resources available to us, both on the RCM, managed care, IT space, security space, and data space, we realized that our associates were really focused on social responsibility. So even though you can see a lot of the work that we've done here with our partner at FAC here in Florida and the PPE deliveries and supporting our foster care children, it's funny how the associates at Health Choice Network, they love volunteering at our health centers. And so the partnership between our health centers and the network really is the driving force behind us being able to hire, retain the best associates possible with the best expertise to support the mission. Next slide. Our services really started with CIO, and they started growing. RCM, value-based services, research, our CFO services, and our quality services. And then, because we had to pivot, you can see the command center up there on the right. That started because of the amount of natural disasters that were impacting our health centers, from fires in California to volcanoes in Hawaii to hurricanes in the south to snowstorms in the north. And so we now have a full functioning 24-hour command center that allows us to pivot very quickly and support our health centers, not just when there's an emergency like COVID-19 or a pandemic, but also look to our partners at the PCA, at the Bureau, even our sister networks to make sure that the centers get what they need when they need it. And then most recently, we focused our efforts around security because we found that the health centers needed a guiding force behind security to make sure not only to keep their patient data secure, but also they end up in the news for the right reasons. And finally, in 2020, our goals are very simple. Our goals were approved by our board, and these were before COVID-19. We're still on track for those, but we also have some new goals based on COVID-19 and some of the partnerships that we're working across the country with our Health Center Control Network partners and our PCAs. The successful rollout of an ACO, we've been very successful, but now we're growing the ACO. Health centers don't realize the power they have with their quality they're providing, and actually need to be able to negotiate and show their might when it comes to their HEDIS numbers. We're developing a full functioning health center MSO that will allow our health centers to not only thrive in the managed care space, but drive the train down the track. We constantly are fighting with our managed care partners for funding and opportunities and to be paid for the work that's been done. But working together allows us to have a much bigger voice with our PCA partners. A data ecosystem, early on, one of the items that made the networks were focused around IT. Well, many of our health centers are using various forms of electronic health records, electronic data systems. Our job is to create an ecosystem that can collect data from each of those EHRs. And that's the investment, the multi-million-dollar investment that we're making on behalf of health centers. And lastly, our RCM 3.0, it's our third version of the RCM. It's really designed not to do the billing and collections, which is pretty simple these days with all the technology, but really focus on making sure every service provided is paid at the appropriate rate. And recently with COVID-19 is making sure the telehealth visits, the audio consultations, the education, the work being done out in the field, whether it's a drive up or under a bridge or at a public park, is counted, and that their good work doesn't go unnoticed. As Fred mentioned, we're the best kept secret as the largest primary care delivery system in the country. And lastly, I just want to say thank you to our healthcare heroes. Dr. Rockman and I constantly are humbled by the work that's being done at the network levels. We have such great partners across our network partners, whether it's the Alliance or OCHIN, with all our health centers across the country and all the PCAs that we work with. So we are constantly humbled by the work that you do, and we're so fortunate to be able to represent you on the national stage when it comes to IT, value-based services, and RCM. Thank you, Tim.
Great, thank you, Alex. We really appreciate those words, and thank you, Dr. Rockman. Both Health Choice Network and Alliance Chicago hosting the series has offered a lot of information to a lot of clinicians and health center staff over the past several months. And as we pivot from this COVID period into the new normal, we look to three strong healthcare leaders that have been around the health center movement and led their own individual health centers, but more importantly, helped to establish the health center controlled networks that we're talking about today, both Health Choice Network and Alliance Chicago. So now we're going to hear from three CEOs of three separate organizations to hear their experience on their health center experience, but most importantly, how federally qualified community health centers have bonded together to form health center controlled networks. We're here from Annie Niesman, Rosalind Fraser, and Bernice Mills-Thomas. But first, let's go to Jesse Trice Community Health System and Annie Niesman. Annie, are you with us today?
I am, Dr. Long. Can you hear me?
perfectly, loud and clear.
Thank you so much. And thank you to everyone on the call for listening in to hear about this history. And I am very humbled to say that I'm the president and CEO of the Jesse Trice Community Health System and have been for the last 15 years, where last year we saw over 45,000 patients at 54 of our facilities, 40 of those being schools, 11 comprehensive primary care services, as well as behavioral health services, oral health services, and a 24-hour, 40-bed women's residential substance abuse treatment center. I, like Dr. Rothman, am very humbled that I knew both Betsy Cook and Jesse Trice, who were two of the women that were very instrumental in starting the Health Choice Network. I was actually in the Miami community when that was done and serving at the Department of Health. So I feel like I was there from the beginning, but certainly I know that as far as Jesse Trice was concerned, that the things that were talked about earlier when Fred talked about you can't do it alone, she was one of those very instrumental in saying that you can't do this alone, that you have to do it together with other health centers, and you also have to do it together with the state PCA, which she was a very strong advocate for that avenue also. So what has HCN meant to Jesse Trice and our growth? I think Jesse and the others who started this movement knew that together we were stronger. There was certainly, as Alex gave you all of the things that we're focused on initially, certainly IT was one of them. When I joined the health center in 2004, we started those electronic health and medical records. And I can tell you that as far as the COVID is concerned, if we had not done that back then with all of the iterations of those systems, and actually having tried it in our school system because of the innovation that we believed in many years ago, it wasn't as successful as we wanted. As Alex said, we had lots of starts and stops, but we started again. And so that really positioned us into going fully into telehealth, whether it was video or telephone, in this new normal of COVID-19 and the pandemic. I can tell you that HCN has been instrumental in helping us. Alex talked about the IT, certainly they're in the background. We don't see a lot of what they do. They have certainly helped us with all of the data that has to be gathered for. Yes, we do the HRSA survey weekly, but there are also other surveys that our funders want. There's many of them that are asking for data also. And the network, Health Choice Network, has been truly instrumental in doing that. I can tell you that also, focusing on this new normal, we are going to need information from all of our partners. And that was one of the things I believe was the commitment of the Health Choice Network back in 1994, that partners were important. That is, the national partners, HRSA, NAC, the state partners, the state association, the legislators, our local partners, the Department of Health, our county per se. Everyone was important then and will continue to be important going forward in this new normal. Health Choice Network has invested in the Bessie Project. That's a multi-million-dollar investment in data. As you know, everyone wants data. We can talk as much as we want, but we have to have that data in order to drive decisions. And we have to have that data really to look at ourselves and look at how we compare with others across our county, our state, and our nation. So as far as funding and foundations, the Health Choice Network has certainly helped us with that. We have gotten many grants because of the partnerships. We can't always go it alone. I can tell you one of the most recent ones, we've been with the ECHO grant in diabetes. They've been tremendous for the last couple of years and have, in this time, I think foundations and grant funders have looked at they have been partnering with and actually given us donations for this COVID-19. So as we go in the future, I would say we have to continue the vision of the networks. We have to continue the vision of partnerships in the network with everyone on the local, on the state, and on the national basis. Continue that innovation, and actually we will all have a brighter future because of this. I always say that we have this pandemic now, but on the other side of this, Jesse Trice Community Health System will be better than it ever was. So thank you for allowing me to share a few minutes on our center, our system.
Great, thank you, Annie. We really appreciate you, and we appreciate Jesse Trice Community Health System. So thank you for all the work that you are doing. And next, we're going to hear from Rosalind Frazier, the Chief Executive Officer of Broward Community and Family Health Centers in Florida. Rosalind, are you with us?
Hello, Dr. Long, can you hear me?
We can, Rosalind. Welcome. We can hear you loud and clearly.
Okay, wonderful. Well, thank you so much for having me, and thank you to everyone who's on this call. And most importantly, thank you for this opportunity to share my experience with being a part of Health Choice Network. But not only that, but to what came to mind is this group of individuals that impacted my life coming from a private sector to the community health center arena. I was a young woman when I met Dr. Rockman and met Betsy Cook, and there's the two women that are on this panel right now with me, Ms. Niesman and Ms. Thomas, have been mentoring me and hearing me out for over 25 years. So I'm just so honored to just be in the midst of these honorable Black women. But I met Fred Rockman in Chicago. I'm originally from Chicago and was a part of Erie Family Health Center. I know we'll probably have 5 minutes to do this, but I'm going to tell a quick story about Dr. Rockman. When he said he was a young man, I was a young woman, and we both were very naive. I hope Fred doesn't mind me telling this story. But I think that I've learned to capture override my fears when Fred and I were left with getting dollars that was owed to us from the state of Illinois for Medicaid to pay our health center. And Fred came to me and he said, Roz, I was the CFO, we're taking the paper claims to the state office and we're going to sit there until they give us a check. In the rain with boxes of paper claims, 2 young, naive healthcare professionals went to state Medicaid office, and we walked out with a check. So that was my first experience in the community health center arena. And then this young woman, Betsy Cook, came in to Louisiana, and that's when I learned about Health Choice Network. Based on what they talked about and not doing things together, one of the things that Betsy Cook brought to the forefront was the HRSA project of doing the peer-to-peer TA. And that's when I learned about Health Choice Network and all the things that they were doing during that time period. But Broward Community Family Health Center has been serving Broward County for over 21 years. I have been the CEO there for 18 of those years. We're the oldest of 2 FQACs in Broward County, and we offer primary care, behavioral health, and oral health services at 5 community health centers, one of those being oral health. I have been a proud member of the board of Health Choice Network and served as past chair of Health Choice Florida. What does Health Choice Network mean to me? Broward Community Family is a relatively small health center in in all of state of Florida, and mostly in Broward County. And we have seen growth to a point where Health Choice Network has helped us through strategic planning through that growth. It's helped us to sustain a state-of-art technology of which we would not have been able to afford, not at a level where we would be able to grow and expand as we have. But they've provided that guide of technology throughout the past 18 years. They've shown us an opportunity of how we can best save our costs and reinvest it internally in operations and improving our quality of care. But all of this through the help of the expert team that we do have at Broward Community Family Health Center in its leadership, but also in the leadership of HCN. The support team that they have in place has been invaluable to our organization and continue to do so as of today. As we began to go through this process of the pandemic of COVID-19, one of the things we learned, where we were able to capture, was the information from who were missing, who should be receiving a telehealth visits, and able to compare those dashboards to what we were pulling in data to ensure that we notified our patients that they could still access services through us. But also the technology and support that HCN has provided us as a smaller organization. We have increased our network speed. We've saved costs over the process of doing that. And one of the areas that a lot of health centers we do have trouble in is how do we train our staff, and they're all learning at the same level, learning at accessing that training through the same systems of which we train people every day, and that access to their learning management system network. We've been able to access their system of training, and that training not necessarily be at a cost to us. But the most supportive part of it is having a community of health centers, of professionals, from clinical support to our providers, that they're able to have conversations with each other that are empowering, but also enlightening, that they can exchange information and know that they have a fellow member of its network, that there is data that they can all look at, benchmark themselves, and also find some best practices within. It's an opportunity to share that a lot of health centers don't always get an opportunity to do on a statewide basis, but that there is a camaraderie that they are able to share what those best practices are within their organization. They also put us in a position that, especially in looking at this new norm, of the value of data that can be validated, that we can use that data to compete and negotiate. There has been times that we present data to different plans where in the past, without an HCCN, that there is always this concern of how valid your data is. But when you can pull your data to the table with theirs, and they see that you are on top of how you're serving the community and the quality of care that you provide, then it brings a level of security to them that partnership can expand outside of internally, but even with our plans. And this past year, we were actually joined first time the partnership with the Humana Foundation. And the Humana Foundation came to us and asked us, would we, if they provided an investment, would we work with them on correlating healthcare and quality services to what social determinants of health, how that impacts it. and not just on that level, but also what is their social connectedness or disconnectedness at this point that this new norm has brought us. How would that turn out, and would we be able to share that data? And we've done so, and the point to that we're able to now work with the community and have community partners that have an interest in Broward Community Family in this county to share that information. So HCNs, RCM services, technology services, technical support, the command center, which is something else I'm sure Alice will share with us more about. That has been that's been the value that is brought to Broward Community Family, that we're able to continue to expand and continue to look at long-term what our strategic plan will be. But thank you guys so much. I'm looking forward to what HCN and the Alliance, what we all do together. I think it's a grand opportunity, and I see nothing but success behind it. As long as we're not afraid to start and restart, I think we're going to do an awesome job. Thank you all so much for your time.
Thank you, Rosalind, and thank you for all of the tireless time you've spent in South Florida and Chicago. You truly are a healthcare hero, so thank you. And next, we're going to hear from another healthcare hero, but for me, my healthcare mentor, a good friend, Bernice Mills Thomas, the Chief Executive Officer of Near North Health Service Corporation in Chicago. Bernice, are you with us?
I am. Can you hear me, Tim?
Perfectly.
Great. Okay. You know, this is really just unbelievable. As I listen to my colleagues and friends and see the names of a lot of them from the past, you know, we don't get out very much anymore these days. So it's just really, really nice to be here with all of you. So I'll just start by talking about us and the Alliance. Many years ago, the late 90s, a group of health center executives realized the need to engage and support each other. There was a lack of resources on a number of levels, including financial, human resources, and even capital needs, just to name a few. We recognized early on that we could better advance our missions through collaboration rather than competition. We still talk about that today. It really helped us to build trust because we had several of the same challenges, the concerns, the same issues. But over the years, we have become very supportive of each other's organization, and this is all because of us coming together all those years ago. From the beginning, members decided to include the resources and skill sets of the clinical, financial, and administrative staff and team members, and that was including the IT team members as well, to assist in the collaborative teamwork and decision-making in order to continue to provide the quality and learning needed to promote the evolution of the Alliance Chicago mission. Because of the lack of funding and the desire to share resources, founding member CHCs embraced the Health Resources and Services Administration, HRSA, concept of the Health Center Control Network. You hear the HCCN early on. And by making this decision, we were able to maintain each other's health centers' autonomy. We were able to continue to respond to our respective communities. The result, economies of scale. You've heard that from the speakers already. Remember, at the time, we were small health centers who were not necessarily able to compete with the larger health systems who had many more resources than, of course, we did. However, we did maintain our focus and commitment to our patients. One of the first official funding sources was the Integrated Services Development Initiative that Dr. Rockman talked about earlier. We call it the ISDI. It was the initial HRSA funding that we received. This allowed us to conduct planning and pilot activities to begin to establish a common infrastructure. However, we were strategically focused and we worked very, very hard and I would like to say that today that made us not work as hard. It just seems like we even worked harder today, but we worked very hard. And because of this, we knew that health information technology was on the horizon. So we formed the Alliance of Chicago Community Health Services to assist us as a vehicle to carry out the electronic health records implementation. And I am so proud to say that we were one of the first in the nation to implement that. It couldn't have been done without the collaboration, however, of several organizations and supporters. This is when we really saw the value of the HCCN. We have pages and pages of partners, individuals, affiliates, and funders who support the work that we provide to communities in need. This allows us to increase our impact within the safety net community by connecting us, healthcare providers, IT professionals, and others to reach our common goal and empower clinicians and other staff members of community health centers. Over the years, however, Alliance Chicago's collaborative approach has empowered clinicians and health centers to meet the healthcare needs of underserved populations by sharing best practices, and data to improve the outcomes and optimize care delivery that has resulted in proactive transformation, quality improvement, and clinical collaboration. Finally, we have been in business for more than 20 years and have expanded from the 4 founding health centers to a national network of 60 community health centers, give or take a few, Fred, if I got that wrong. We are so thankful for being a part of a network that has provided many best practices over the years, and we continue to innovate and collaborate and provide that service excellence that Alex talked about at the very beginning. So thank you for allowing me to discuss briefly, because my colleagues all know that I could go on and on and on when I'm talking about things that are near and dear to my heart. So I thank you again for allowing me to say briefly a few things about the Alliance Chicago and the community health centers that form the Alliance. And everything that we have done in all of those years have set us up and prepared us for living with this COVID-19 situation that we find ourselves in today. So that sisterhood that Rosalind talked about, the HCN Alliance, I am so excited about what that will do, what we've already done, but what it will continue to do in the future. So again, thank you so very much for allowing me to come and talk about all of these things. Thanks, Tim.
Great. Thank you, Bernice. Thank you for all of your years of work, but there's many more to go. And thank you for those words. And most importantly, thank you for your leadership during this time. It's very challenging. And all 3 of you are examples of how you have put in the time and to gain the experience to move us through this COVID period. So thank you once again. And as we move to our next section, again, our interactive poll, if you want to take out your cell phone and type in 22333 and put in COVID-19 heroes, please share one word with us to describe your health and controlled network and PCA partnership during this COVID-19 period. We'll be collecting these words over today's webinar. And next, we're going to pivot to collaboration in action. We're going to give a few examples of Health Choice Network and Alliance Chicago working together to set up this period of COVID-19 and beyond, which is all about today's webinar. We're going to hear a little bit about clinical engagement. Then we're going to hear from our partners on the Betsy Project. You've heard about Betsy Cook already today, and hopefully heard about her in the past. Then we're going to hear a little bit about research. And then finally, we'll cap this section off on collaboration with some great information on an upcoming virtual conference. So if we move into our first section under collaboration in action, we're going to talk about some clinical engagement. And I serve as the Chief Clinical Officer for both Health Choice Network and Alliance Chicago, and what an honor that has been to work with all of these phenomenal individuals every day. And we have been able to share clinical priorities across both networks. So as was mentioned, with all of the health centers within Health Choice Network and also Alliance Chicago, bringing them together, hundreds and hundreds of health centers across the country with different locations of care, we have focused both of the network's clinical leadership on 4 main top clinical priorities. That's not the only clinical priorities we're focusing on, but they are our top. Diabetes is number 1. We have heard from our funders, who we'll hear from in just a little bit, that diabetes is here to stay, and it's our job to help prevent diabetes and manage diabetes. So we have done a lot of programming and will continue to do programming across both Health Choice Network and Alliance Chicago on diabetes. Next, top clinical priority is cardiovascular disease. As many of us are aware, still more Americans die of heart attacks and strokes, cardiovascular health and disease, than any other American. We're having programming in Target BP and also Million Hearts to make sure that we can improve blood pressure control in African Americans, put people on statins if they should be on a statin, and then finding people hiding in plain sight to make sure that we can prevent blood pressure from even occurring. Third is we are tackling the opioid crisis. We have formed an opioid task force, and we're continuing to do more and more programming, including a potential for an opioid echo series coming up for both networks. And finally, on the 4 top clinical priorities, we are going to end this HIV epidemic. HIV has been a part of many of our lives and medical care for a long period of time, and we are now at the forefront of being able to end HIV, and that's a phenomenal thing to say. We'll be able to do programming and partnering with many other national organizations and engaging health centers from both networks across all of those states to make sure that we identify people who should have an HIV test, get them into the right form of treatment if they're HIV negative but at risk, or get them on medications immediately if they are HIV positive. And then another top priority is immunizations. We're focusing on adults initially, but we're focusing on immunization, partnering with the CDC and the National Association of Community Health Centers. And this work that we are doing across both networks with immunizations is going to help set up a framework in which we can vaccinate people who need to be vaccinated once the COVID-19 vaccine is available. We'll be doing a lot more programming on vaccinations for that to come. Next, all clinical leaders across all health centers across the country are available to join us in a 3-day immersive event where clinical leaders come together and learn from each other through a facilitated peer learning. This is open to emerging clinical leaders, chief medical officers, dental directors, and behavioral health directors. Unfortunately, last week we had to cancel the in-person 3-day webinar that was going to be held in Chicago, but more to come. We will be doing this again. We have one scheduled in the fall in Miami, and everyone is open to join that. However, we might have a virtual clinical leaders workshop soon. Next, we just want to put a plug in for this webinar series. This is our 9th COVID webinar series. We've had either weekly or every other week starting on May 18th. All of them are recorded. We have heard from health centers. We have heard stories of phenomenal work, ingenuity, innovation being done at all of our health centers. We'd like to share that information with everybody. So we will send out the link to each of these past 8 and now the 9th COVID-19 webinar series. Please share that information. The slides are available. And this is a way across both Health Choice Network and Alliance Chicago and also our other partners to be able to share information that's being done at all community health centers as we are all in this work together across the country. So next, I'm going to turn it over to my colleague and good friend, Andrew Hamilton, for our next section in Collaboration and Action, the Betsy Project. Andrew, are you with us?
Yes, I am, Tim. Thank you. Can you hear me all right?
Perfectly. Thank you, Andrew.
Excellent. Well, thank you all, and let me add my thanks and gratitude to the speakers for today, who many have been a guiding light for me in my journey in working in community health. I also have the honor today to present some background information and high level of the Betsy Project, which is a collaborative effort between Alliance Chicago and Health Choice Network. I appreciate very much my colleagues, Mei Lee, the CIO of HCN, and Trice, who serves as our project leader. Without them, what the work we're presenting today could not be possible as well. So the purpose of the work we're doing together is really to move forward with the development and implementation of an enterprise analytics infrastructure to support outcomes improvement and effective adoption of technology across all the participating health centers that are part of Alliance Chicago and Health Choice Network. This initiative and investment by the two organizations, the two networks, is really to further the mission and underlying work of the networks that you're hearing about today. Specifically, the clinical work that Tim just mentioned, amongst other projects we're doing around quality improvement. And soon you'll hear from our colleague, Dr. Nita Mohanty, about how we leverage this infrastructure also for research. We have a shared vision, and that's what brought Alliance Chicago and Health Choice Network together. Both organizations are coming from a place where we've dealt with silos of data in many formats and many different applications, both data that we house and host at our data center, but increasingly data that's coming to us from our partners across the healthcare ecosystem, payers, public health colleagues, community health service providers, and social service agencies. The focus of this infrastructure is first to centralize our analytics into a common platform. From there, we then want to use that centralized infrastructure to develop applications that can be used to drive data-driven improvement in quality improvement, clinical decision support, predictive analytics, research, and secondary data analysis. We see this as an iterative cycle, that as we develop the tools in applications and further are able to add data from various systems into our centralized infrastructure, we can further the cultural movement to inform decision-making through the use of data. Next slide. Our work will focus on initially providing the tools and resources necessary to capture the data from all of the source systems that are part of the healthcare ecosystem of Alliance Chicago and Health Choice Network members. That includes data sources for supporting accountable care entities, value-based services, revenue cycle management, quality improvement, and research. Once data has been captured, we hope to organize that data into use for meaningful output and analytic uses. Through this work and effort, we'll be able to deliver insights to all of the teams that are making critical decisions at our healthcare organizations. And furthermore, we'll be able to use this data to inform predictive analytics that can begin to help shape and be co-developed as sources of information to inform decision-making. And finally, we hope to ease the pain of distribution of data for informing decisions by providing more intuitive, high quality, and easy to use applications that present data to all kinds of users in our ecosystem. Where we are is we're at the end of the first phase of the project of fully integrating data from the initial data sources. That was work we did in the first 3 months of the project, including the ability to match patient data from multiple data sources using an electronic master patient index feature. From there, we'll be focused on delivering high value applications, and by the end of the 6 months of the first phase of the project, we'll be developing tools to support revenue cycle management and analytics, managed care services, quality measurements, the development of patient cohorts for research and quality improvement, as well as dashboards to inform decision makers in our healthcare ecosystem. And with that, I'd like to turn it over to my colleague and friend, Dr. Nita Mohanty.
Thanks so much, Andrew. Can you all hear me okay? Hello?
Yes, I hear you, Nita.
Oh, great. Thank you. Well, good afternoon, everyone. I want to start by thanking everyone on this call for everything you're doing to support patients in your communities this time. Thank you so very much. I'm very glad to be with you today to speak about collaborations for research and quality improvement. Next slide, please. So COVID-19 has generated a great deal of awareness for the need for more health disparities research, as you can see from the web meeting that was held by Dr. Francis Collins, who's the director of the National Institutes of Health. Next slide, please. There's not only a critical need for more health disparities research, but also a need to understand the disparities in how research is being conducted today. Each of the examples that you see in front of you right now illustrate how excluding populations from research has impacted the effectiveness of treatments and care. We know that racial minorities, people living in rural areas, and people with chronic diseases are often excluded from research, and this leads to negative consequences for their health. Next slide, please. This image may be familiar to many of you. It's of the Learning Health System, which offers us a framework for how we can generate knowledge in a manner that is more collaborative, inclusive, and faster by leveraging technology to capture data from the care we provide. And this directly relates to the slides that Andrew shared previously. These insights can inform science and evidence and further improve the quality of care we provide to patients. And I can't emphasize enough that collaboration is core to realizing the success of this model. Next slide, please. I want to share just a little bit of my own experience of understanding how critical collaboration is for making research and quality improvement meaningful for patients. Several years ago, when I practiced full-time, it was a patient that made me really thoughtful about research. It was a young mom whose newborn baby needed to be evaluated for jaundice. And she tearfully asked me if there was any way that instead of drawing blood from her baby, we could use what she called the machine from the hospital. And what she was referring to is the machine that you all see at the top right corner. It's a sensor-based test often used in hospital nurseries, but at the time it was not widely used in primary care. And it turns out there were very good reasons for that, because there wasn't much data on sensor accuracy across different skin pigmentation or how it worked in primary care. So we embarked on a journey to do the research so we could understand the accuracy in our population and safely implement this non-invasive test. This was a team sport by all measures. Patients were obviously integral to this process. I had the benefit of working with the brilliant pediatrics team at Erie Family Health Center, including my fellow pediatricians and medical assistants who were willing to think through how to make this project work. We collaborated with our academic partners at Northwestern to get seed funding and to also help us with the design and statistics that we would need. We got tremendous informatics support from the network, from Alliance Chicago, and we worked with them and our IT department to help us create EMR forms and structured data so we could successfully implement and evaluate the project. The end result was that this collaboration allowed us to safely introduce this non-invasive test in practice and fulfill the wish of other young mothers out there. If you could advance the next slide, please. Now, at the network level, we want to create more opportunities for this type of collaboration for staff at health centers. I love this photo from one of our research meetings. It includes patients, health center staff, staff from our partner PCAs, and academic researchers who came together to collaboratively develop research questions that are most meaningful to community health centers. Next slide. This mission of identifying the needs in our communities has informed our work with non-clinical social service organizations as well. I'm sharing this example of our team efforts to address maternal mortality. As you can see from the graph on the upper left corner, that compared with our international peers, we see other countries are universally seeing a decline in maternal mortality, yet in the United States, mortality is increasing. And we know that women of color are disproportionately being affected. The Safer Childbirth Initiative is a multi-regional one, and we are very proud to be partnering with community health centers and social service organizations to affect change in our community. Next slide, please. We've had the wonderful opportunity to collaborate with multiple other networks, including Health Choice Network, through the NAC and CDC-supported Million Hearts Initiatives collaboratives. This quality improvement work leverages data, evidence, and peer learning to help us address cardiovascular risk in our communities. Next slide. I think we all have really great opportunities ahead of us to change the dialogue about health disparities. and to truly achieve equity for patients so we can tailor our services to their specific needs. We are very proud to be working very closely with Health Choice Network on shared research and quality improvement areas to achieve this goal. And our collaboration includes multiple projects in shared areas of focus, such as research capacity building, public health priorities, including COVID, chronic diseases, social determinants of health, health information technology, and how we can use it to inform health outcomes, and last but certainly not least, the patient and care team experience. Next slide, please. And with that, I thank you all so much for your attention, and I'll share a wish for more opportunities for us all to work together in our shared journey to address health disparities, and that we can continue to go far and that we can continue to go together. Thank you.
Great, thank you, Nita, and thank you, Andrew. We really appreciate those words of collaboration in action. And next, as you can see on the slide, Health Choice Network and Alliance Chicago are planning something big. I think Alex might be on the phone with us, and he might want to say a few words about the Alliance Chicago and Health Choice Network's Virtual Education Conference. Alex?
Hey, Tim, thank you. First of all, I just want to thank everyone that presented, the CEOs of the health centers, our true heroes, our mentors, our guides to this crazy challenge of health information technology and patient care, and my heroes, Andrew and Nita, which always are pushing the envelope to do better for our health center patients and the data. Such fantastic clinicians driving the ship. So we appreciate the partnership with Alliance Chicago. And this COVID-19, as mentioned before by Bernice, does provide some opportunities. And the Alliance Chicago every year hosts an amazing conference for all their members, and Health Choice Network does ours, and the PCAs do theirs. And we've been talking for years on figuring out a way that we can bring people together by sharing best practices and learning from each other together, despite the EHR, despite our focal point. So it's really been great to turn this COVID-19 pandemic into some type of silver lining, where Fred and I spoke for years and said, maybe this is the opportunity. So we're really proud to announce that the Alliance Chicago and HCN are going to combine our virtual educational conference this year later in the fall. You're all invited. It doesn't necessarily, you don't have to be a member of our networks to join us. We're going to have some group sessions. We're going to have national speakers talking about the changes in healthcare and patient engagement. And then we're going to split out into our own respective areas based on the technology that we're rolling out, and then really come back together again around our partnership. So I want to thank the Alliance Chicago staff and the Health Choice Network staff that work so hard to put our conferences together. It takes years of planning. Just 1 year, you're finished, then you start the next conference right after it's done. So I really want to thank the team for coming together, and we're excited and hope that you can join us. More information will be available on our website, but really this is a collaborative, and this is the best news. The best news is we're going to be working very hard with our partners and network funders to make sure all health centers can join, because we know it's a very difficult time, and registration fees are things that you don't have to worry about. So we're really excited. And I want to thank Fred Brockman, my mentor and hero as well, for allowing me to go down this journey with him to figure out how networks and PCAs and partners across the country can work together for one outcome and one outcome only, making sure our health centers are constantly at the forefront of healthcare and providing access to their communities. So thank you, everyone, for your time and effort, and I'm looking forward to the next topic that Tim will introduce our next speakers at. So thank you.
Great, thank you, Alex. And we are looking forward to that next step and how we'll take this conference to the virtual world post-COVID. So next, we're going to turn to our national partnerships. And we're going to hear from both two individuals who probably don't need any introduction, but I will introduce them. So from HRSA, the Health Resource and Service Administration, first we're going to hear from Suma, and then we're going to hear from our partners at the National Association of Community Health Centers and Dick Bohr. So first, Suma, are you with us? Can you hear us?
I am. Thanks, Tim.
Great. Thanks, Suma.
Good afternoon, everyone. Thanks to both Health Choice Network and Alliance of Chicago for the opportunity to join you all today. I applaud your efforts to support health centers in their response efforts right from the beginning of the pandemic, arming them with the best information and resources available as we face unprecedented circumstances across the country. A key to successful crisis management is robust communication and information sharing And early on, you created this forum for health centers to come together and share key updates, challenges, lessons learned, recognizing the power of peer support and exchange. You all have exemplified some of the key attributes of our national vision for a learning health center system or national health center network. And while much has been accomplished to date, and I thank you all for everything that you've done to support the patients and communities, I think we all appreciate the reality that there's much more to be done to get us on the path for recovery and success in the post-pandemic environment, where there's probably going to be significant shifts in healthcare. Our mission, however, does not shift. We continue to be focused on increasing access to high-quality, culturally competent primary health care and reducing health disparities in underserved and vulnerable populations. As you all know, HRSA has invested over $2 billion in health centers over the past 6 weeks to support health centers in their response and recovery efforts. While these resources have been instrumental to protecting staff and patient safety, ramping up testing capacity, shifting to more virtual care, and finding ways to maintain operational capacity, we know that additional support is going to be necessary to maximize the impact of these investments, both in the near and long term. Therefore, we plan to award supplements to our national partners, our primary care associations, and our health center controlled networks to provide robust support to health centers as we continue to navigate through the pandemic and rebuild access to comprehensive, coordinated, patient-centered primary care. We're asking our strategic partners to work together to help health centers effectively manage through the crisis and facilitate health center efforts to innovate and deliver robust primary care services into the future. We believe that future success requires strategic, coordinated efforts that include technical assistance, information sharing, policy analysis and feedback, partnerships to address clinical, financial, and operational issues that health centers will face, and those are important to help us maximize the collective impact of health centers across the country. In the last decade, health centers have made tremendous enhancements and improvements in their care delivery model and outcomes, including maximizing the use of electronic health records and health information technology, such that every health center now has a ONC certified system, to the implementation of team-based, patient-centered models of care. Over 75% have that national recognition, to integrating behavioral health, oral health, and substance use disorder services, to focusing on social determinants of health to improve individual and population health outcomes. In addition, these kinds of collaborations have raised the profile of health centers nationally in research and innovation, both of which are critical to advancing our shared mission. These accomplishments were achieved through strong collaborative efforts across our partners. We needed our national training technical assistance partners, our state and regional primary care associations, and our health center controlled networks to make this happen. Each entity playing an important and complementary role alongside of our health centers in our learning health center system, from building out our data and technology capacity to facilitating peer learning and sharing to rapidly improve outcomes, to taking health center level data and insights, to rolling them up to provide state level views, to support policy, funding, and improvement changes, to then taking that up to the national level to help us learn nationally, as well as facilitating national policy and programmatic changes by telling the national health center story. Seamless partnering across each of these groups to identify barriers and opportunities to advance our shared mission has been critical to our success, and I think it'll be important to our continued forward momentum and growth over the next decade. While the only thing we can be certain of is change, that healthcare delivery, health policy, payment policy, and state and local environments will continue to evolve, what we can count on is when health centers work together to leverage economies of scale, share data, and maximize their ability to benchmark and rapidly learn from each other and improve, they're better positioned for success. Together, you're able to achieve more, and our partners and their strong partnerships are essential to this effort. As you may be aware, and we've had previous conversations, we've been thinking about the future of the health center program here in the Bureau of Primary Health Care and HRSA. And as we look ahead towards our vision for health centers in the future to be leaders in primary care and population health improvement, as well as models of operational excellence and value, a key factor in achieving this vision is our ability to strengthen our health center network. We want to leverage the collective power whether it's buying power, insights from the volume of data that you have or the influence you have given the number of patients and communities you serve, or by working together, you'll be able to maximize the impact of your individual resources. Individual health centers or smaller communities often lack the volume of data, analytic capability, or human resources to fully leverage technological advancements, advanced analytics, or engaging in research. But together, in networks and networks of networks, you'll have the ability to engage in and bring significant value to the patients and communities that you serve. You'll also be better tapped into the national collective or the network of networks to create a robust learning health center system. So you'll see continued efforts from our side and a growing emphasis on collaboration and partnership, peer learning, use of data and innovation to drive impact and value from HRSA and from the Bureau of Primary Health Care. In fact, we'll be looking for novel ways to leverage the health center network and the collective health center network, the national group, to help grow the impact of the health center program into the future. Thank you all for actively engaging with our strategic partners, so all of the health centers for doing that, and for supporting and honestly sometimes really pushing their innovative ideas for non-traditional cross-sector partnerships. Hats off to the strategic partners on the call today and those who will come after me to speak today on your efforts to reach across traditional lines and move beyond passive support of our shared vision of collective impact to bravely seek out novel ways to work together. You all have set the standard and continue to push us all forward. Thank you all for all that you do for the patients and communities that you serve. I look forward, and everyone here in the Bureau of Primary Health Care looks forward to our continued partnership as we advance on our shared mission.
Thank you, Suma. Thank you for your leadership, and thank you to the continued partnership and support from HRSA. We really appreciate it. We appreciate all of the efforts that HRSA has done for community health centers during this COVID period and beyond. So next, we're going to hear from the National Association of Community Health Centers and our friend and partner, Dick Bohr. Dick, are you with us?
Yes, I am, Tim.
Great. We can hear you loud and clear.
Okay. And for the record, the the picture was taken when I could still get a haircut. And so bear with me. The more you work with health centers, the more you appreciate that it's not about a health center. It's about being part of a movement. It's a movement that, yes, local communities have their health centers. Most health centers are now fortunate enough to be part of a network. And almost all health centers are part of a state primary care association. And then finally, many of them participate in national organizations like the National Association of Community Health Centers. Because that's what makes a movement strong, and what makes a movement is people. Certainly today took me a little bit down memory lane, remembering some of the people, that it was said by a couple people earlier that without individuals like Betsy and Jesse, wouldn't be even having this part of this conversation today. I'm going to share with you thoughts in 4 areas. A little bit about that history, a little bit about the present, a little about the future, and then what are the takeaways for me. From history, I remind you of 2 things. Networks began because a group of health centers thought they could do more working together to solve a problem than working alone. Thank you for the picture of the elephants crossing the road, because I believe that is a great way, to sum up, what early adopters in the health center world of networks, saw. But I think secondly, that was critically important. The people within the different communities and states who started networks, they identified meaningful functions that they wanted to work on. It wasn't some federal or private or state funder. Rather, it was people saying, we need to do more and better than what we have the resources to do independently. Fred talked a lot about the clinical, management. For me, networks began, around financial management. Folks wanting to be able to do a better job, of handling the resources they had. Human resource management was another thing. So those two things are what I take away from history. In terms of the present, it's very, very interesting. The idea that there's not a one size fits all for networks. About 70% of the operational networks today are funded by the Bureau of Primary Health Care. But there are therefore 30% of the operational networks, who same mission, same purpose, same focuses, but are not, they're part of the family, but they're not a funded part of the family. Secondly, the geographic focus of networks is very different. You've heard two examples today of what I call the multi-state, types of networks. And there are obviously others like that. But many of the networks focus on a single state. And then you've got a large number, especially in California, where you have networks that focus on what I call regions or sub-state. The one thing I would submit to you, regardless of geographic focus, all of the networks, if they're going to ultimately be successful, collaborate with at least one, if not more, primary care associations. Terribly important. It's been said, and I know the three guys coming after me, will drive home that point. And then finally, the scope of work. That for many networks, the Bureau funding is essential. It's what got them off the ground. It was the launch. But it's today, for many of the networks, it's the floor. It's what enabled them to then branch into other, areas of need and seek other resources to do that. During COVID, what we've seen is exactly what you would expect. Networks, shifted priorities and focused on what their members needed, whether it was supporting them as they moved to do more and more virtual visits, whether it was helping them be the best that they could be in testing the people who are at most at risk for not being tested and not finding out if they are positive. Networks have also helped put the spotlight on the health disparities that exist, unfortunately, too much in this country still. And again, COVID has merely opened that up for all of us. Networks have also, found creative ways to find operating capital beyond the federal investments, that have been made through the supplemental appropriations, but find access to operating capital so that their member health centers stay intact, stay in business, and stay ready, for the next phase. When we get out of crisis, when the transition begins, and we move into hopefully recovery, and we see we know what's going to happen. We know what's going to happen. We're going to see people who delayed care. We're going to see people who, by virtue of employment, have lost insurance. We're going to see increased demand, in health centers. So even though volume may have been reduced these last 3 months, it's going to come back, and it's going to come back double or triple what it used to be. Looking to the future, Suma mentioned, that a challenge had been thrown out, to the Health Center Controlled Network Task Force, to start thinking about the network of the future. This was before COVID, and what the implications were, and how networks could challenge the Bureau of Primary Health Care, as they think about the future, that they think about the future role of health centers, of primary care associations, and of networks. To that end, NAC's Health Center Controlled Network Task Force and the leadership team of that task force, have been looking at that question, the future of networks. I think it's becoming even more clear, and today, certainly reinforced the notion. Data, we have way too much of it. But what we don't have is actionable information. There are no other organizations, that we work with directly that have the capacity to take that data, put it into an actionable information format to inform policy, operations, population health. That has to be a part, on steroids for what networks do in the future. Certainly the role in clinical will continue, but I think we'll see a slightly different, look to clinical. We're going to continue at some level virtual visits. We all know that. What will that mean, and what will the role of networks be there? And then finally, there will certainly be a training and technical assistant responsibility that networks will share with primary care associations and organizations like the National Association. So finally, what have I seen over the years, that's consistent and that kind of, cuts across? First, and I know the name of this session today is collaboration, but that's what it is. It's collaboration at two levels: between, in the sense of the collaboration of members, but it's also among. It's the collaboration, then with the Primary Care Association. It's the collaboration with other networks. It's the collaboration, with national organizations. That will be critical moving forward. The second consistency, return on investment. Networks, have had to answer repeatedly, well, wait a minute, why do you spend money on these things? What's the point? Why don't you put more money, into direct services or bricks and mortar? Well, the fact of the matter is that because of that, being asked that question, networks, have become very, very smart at being able to show the return on investment. In part, because of what I said earlier, that choosing meaningful and essential functions where they can, help, get something done that needs to be done. But that challenge to show return on investment will never end. So keep collecting the information, keep providing it, to the task force and to NAC, so that the Bureau of Primary Health Care, because it will be asked the question of why in the world do you spend money on networks? They'll be asked that question in November and December, whenever there, is a presidential election, whether President Trump is reelected or whether there's a different person elected. That, group of people that come in through transition will ask the question, what's the value of networks? Return on investment will be key. And then finally, is networks have always been health center controlled. I think it was Bernice, but I may have got, who said they gave us a way to have autonomy with economy. And I never thought of it that way until today, but that's exactly it. Controlled by health centers, but with a purpose of achieving, economy. Tim, thank you for the opportunity. Thanks to folks on the phone for the work you guys are doing, and look forward to the questions, and also look forward to hearing from the next panel. Thank you, Tim.
Great, thank you, Dick, and we appreciate your leadership in the past, the present, and the future, and we take up those challenges to find return on investment. And it's all about collaboration. So here you can see our word cloud as we move into our partners and collaboration at the state level. It is so key that we work so closely with our state level partnerships. And now we're going to hear from 3 of our close partners. First, we're going to hear from Andy Berman in Florida, then Aaron Todd in Iowa, and then Jordan Powell in Illinois. But first, let's hear from Florida. Andy, are you with us today?
I am. Thank you, Tim. Thank you, everybody. Appreciate the opportunity to be on this call. The Florida Association of Community Health Centers. We're a large state, as most of you know. We have 47 health centers and 3 lookalikes, of which we represent across the state. Our health centers serve over 1.6 million people, over 6.5 million encounters, so it's a very large population. The focus of the association, besides the expectation of doing technical assistance and training on specifically requested topics, we mostly focus our energies on providing resources to the health centers through funding, but it's not all funding, of course. There's also resources related to regulatory and policy changes that are required to assist the health centers in doing what they need to do. And probably our other main focus is on advocacy and government affairs. I would say we're probably the main government affairs body for the health centers in the state, and that really at the state and at the federal level, working with NAC, of course, and at the local level as well, working individually with each of the health centers. So over the years, we've been successful in a number of things. I would say, for one example, most successful in providing some funding resources through Florida's low-income pool. For the last 15 years, we've been able to generate about $500 million to the health centers. Those other changes that I talked about earlier on state policy and regulatory changes have also been a big part of our success story for the association. Next year, we'll celebrate our 40th anniversary. So as it relates to partnerships, in our case, of course, Health Choice Network, we've partnered with Health Choice Network, well, at least since I've been here for 18 years. During the normal course of business. Each of us have very specific responsibilities. I'm happy to say that they complement each other quite well. Under normal conditions, we work on numerous statewide strategies that require things like data, yes, information to bring opportunities to fruition. You got to have that information. We rely very closely on Health Choice Network to help us get that information. And more so than that, we share a lot of the information with our health centers to make sure that everybody's on the same page. Florida has a robust history of emergency preparedness. I don't think we need to belay that too much. A great deal of work has been done by the PCA in emergency preparedness, but a lot of that has been together with Health Choice Network, always with the needs of the center staff and the patients first and foremost. To be frank, there's no way that our small state association could handle the massive workload that's put on us during an emergency duress situation without the help of our partners. And Health Choice Network, in fact, have worked closely on everything from logistics to communications, even shipping and delivery for hurricane things like generators and things like that. During the current pandemic, our work together has probably become more critical than ever. We've been able to work closely on a number of things, one of which is already the horrid PPE for all of the health centers. And frankly, working on the vetting and the purchasing and the shipping and warehousing and delivery, et cetera, tracking, utilization of test locations, all those things that are critical to our health centers. We have worked hand in hand as a team with Health Choice Network on every one of those points. All of this information that we gather together, though, all of it is used in front of legislators, our governor, and state agencies. And to Dick's point, we at the PCA, we have to make this data actionable. So it's important to have correct data. But it's a joint effort between both Health Choice Network and FAC, and of course the result of that is a quick action, hopefully. But it's more than just data. This is a people business we're in, and the partners that you have need to have the same caring and faith in the people they work with. Alex and I have, and our respective employees have formed a team approach to the things that we're doing. It's worked very well. It's formed bridges in places where there weren't bridges before, not only among people, but across centers and across other agencies as well. And it's put our centers in a better place. if I was to say, what does the future look like in regard to the PCA? I would say that as the state policy instigator for our health centers, we have had to look at things like everybody else, APM, MSOs, ACOs, and how to move forward towards value-based payment reform. There is no way that we could do this without HCN's engagement with us. As part of our family, it's critical to be able to share information across a number of lines and find ways to find appropriate solutions for future funding and fiscal strategies for the health centers. And Health Trice Network, in fact, together have worked on a number of these things. Of course, HCN has a working ACO. They have been engaged through Prestige before that, so they have an extensive amount of experience. And of course, it balances against our health centers who may or may not be engaged with HCN in the state, but see the effort that's been put out there, excuse me, as we move forward. So I would say that both Alex and I are fairly seamless in our desire to find the right strategy to protect the financial viability of our centers. And at the very least, our members in Florida, they have high expectations for us moving forward. I'm going to close with this. One of the things we've learned from COVID-19, the relationship between FAC and Health Trice Network, I think, brings a bigger point. It needs to be more than a business relationship. It has to be an equal collaboration. Each of the organizations have a critical role to help to lift up the centers, and that's rewarded us in Florida with success. Fact of the matter is, in many ways, we really need each other, and we've worked in that regard that way. So I'm going to stop there, and thank you.
Thank you, Andy. We really appreciate those words and look forward to working and collaborating with you and your team more. Hopefully, we won't have to worry too much about the hurricane season on Monday. We'd like a little breather as we move out of COVID into the new normal, the weather.
Hallelujah.
So next, we're going to turn it to the middle of the country, and we're going to hear from Aaron Todd, the Chief Executive Officer of the Iowa Primary Care Association. Aaron, are you with us?
I'm here. Thank you so much, and good afternoon, everyone. Thank you to Fred and Alex and all the others at the Alliance Chicago and HCN. It's really great to be with you. It's always fun to collaborate with your great organizations. I will be brief to hopefully get us a little bit closer to back on time as well. I'm just going to basically reiterate lots of comments that have already been said here, that each of our organizations have their unique specialties, wisdom, expertise, resources, and what we want to collaborate in an effort to not duplicate and to leverage those resources to the greatest extent. So you can really think of the HCCNs as having that data, which is the currency of healthcare, and really moving into the realm of making data actionable information that all of our health centers can use, and that we can aggregate up to network levels to really understand the drivers of the work that we are trying to accomplish. And then the PCAs traditionally having that technical assistance that we provide directly to the health centers on a myriad of issues related to compliance, quality improvement, and a variety of other issues. And then advocacy, the essential arm to spread the message about the impact of community health centers and why it is essential that we support them in the long term. So what you're seeing on your screen here is just a very brief introduction to who we are. We are a little bit different configuration than some others in that we are a state-based PCA, of course, but then also a state-based HCCN called In Concert Care. We have our health centers in Iowa as well as one in Nebraska that are our members. And then we also partner with the Alliance Chicago in particular through a contractual relationship, but I think even more importantly as a trusted partner and advisor for the work that we do and collaborate on a variety of fronts. And then we also host a clinically integrated network called Iowa Health Plus, where we do a lot of work about the future. This is our arm that is really thinking about care transformation. This is our arm that is contracting with managed care companies for shared savings arrangements and the like. So you can see that we have a very state level focus in the work that we do. Each of those services under those organizations differentiate them in some way. There is one common thread across all of them, and that is the Performance Improvement Learning Collaborative. We don't actually use that terminology anymore. We now call it the Transformation Collaborative, but the Performance Improvement Learning Collaborative seems to make sense to outside entities when we talk about what we do. So all of the staff that work on these initiatives are housed in the same place, or at least we used to be under the same roof. Now we're all remote, of course, but under the auspices of the Iowa Primary Care Association, who then operates each of the other two entities. So that does provide us some considerable efficiencies and enhances collaboration quite a bit. I lead all three of the organizations, and then we have staff that focus their attention in each of these spaces. And what that really means are in good times and in more challenging times like today with COVID-19, we can pull together those interdisciplinary teams so that we have the right expertise at the table to tackle whatever the issue might be at hand. So as it relates to COVID-19 specifically, we created essentially a command center where we pulled in our HIT leads, we pulled in our quality improvement leads, we pulled in our person focused on compliance and technical assistance around policy work. We pulled in our communications director, and we have worked as a team now over these past few months to understand how can we best serve our health centers in this moment of challenge. So a couple of the things that we did, and I'll be brief here, is that we really focused on sharing information, distilling regulatory changes to meaningful information, and answering questions for our health centers. We all felt that onslaught coming in on a variety of fronts, whether it was how we operate, workforce issues, and the like. We needed to understand what was happening at the federal level and at the state level. Most importantly, we provided a forum to learn from each other. I'm sure this is a similar experience that you all have. Our health centers love to meet in some type of facilitated type of setting to talk about a particular issue at hand and to understand how others were dealing with that issue. We really felt like there was a wave of COVID-19 that moved across our state from east to west. In the very early stages, our eastern health centers along the Mississippi were feeling the impact quite acutely, while those on the Missouri River in the western side of the state were still operating under normal conditions where very little had changed. And they were able to really benefit from what was happening on the east side of the state, where they had a couple of weeks, frankly, to really catch up on that work. We also developed a rapid response team where not only did we provide technical assistance that was for all of our health centers, but we were able to connect with each of our health centers independently to understand what were their unique challenges, how could we support them in meeting those challenges, or could we connect them with another resource that could do it better than we could. We also did a lot of information sharing, and this is where the HCCN comes into play, where they collected information from our health centers and were able to have some robust tools to understand what did our testing look like, what types of populations were being served, how many people were testing positive, of course, was this impacting our health center staff, and to what degree. So we were able to share that information with our health centers, but also use it in the way that we communicated in particular with state government, who wanted to really understand what was happening in each of our communities. We tied that together then also with financial information. We developed in partnership with BKD a way of projecting impacts at each of our health centers so we could get a statewide look of what we were likely to face under different time delineated scenarios. We're able to aggregate that up and understand how to advocate most strongly for what we needed to both meet the demands of COVID-19 and exit this pandemic without decimating our capacity, which we also know will be necessary given the economic downturn that we're all going to have more patients knocking at our door. Additionally, it had the added benefit of having all of our health centers thinking through the financial impacts of the work that they do in COVID-19 and ensuring that we were being thoughtful about how to address those issues. Of course, standing up telehealth was really quick. We only had 15% of our health centers having robust telehealth services prior to COVID-19. Now we're at 100%. And again, we were able to really marry that technical expertise, the data side, the technology implementation and deployment with the care transformation side. And what does that mean for workflows? And what does that mean for getting providers comfortable with using the technology? What does it mean for the patients to be comfortable utilizing that technology? And how do we build on that for the future? How do we make good, strategic, long-term decisions today that meet our immediate needs while thinking about the future? So with that, I'll turn it over to the next speaker. Just really appreciate being invited and really look forward to future collaborations with all of you.
Great, thank you, Aaron. We really appreciate all the work that you're doing with Iowa Primary Care Association, In Concert Care, and all of the work that your health centers are doing. It's phenomenal. So next, let's stay in the heartland, but move a little bit east to the land of Lincoln. Let's hear from Jordan Powell, the Chief Executive Officer of the Illinois Primary Healthcare Association. Jordan, are you with us?
Yes, I am.
Great.
Well, thank you, Tim, and good afternoon, everyone. And thank you to Tim, Fred, and Alex for the opportunity to speak this afternoon. And I also want to acknowledge a health center leader that spoke earlier on this call, and that's Bernice Mills-Thomas, who has been a personal mentor to me and a tremendous leader, not only for health centers in Illinois, but throughout the country. So Bernice, thank you for your leadership. And I know we're past time here, so I'm going to be very brief, but I want to say that we really value our partnership with the Alliance Chicago. And to provide a little historical context, when the last HCCN funding opportunity was announced, as the PCA, we had a choice to make. We could pursue the opportunity on our own, or we could partner with another HCCN. And to me, it was a no-brainer to partner with Alliance Chicago for several reasons, including their location in Chicago, our PCA's lack of experience in health information technology, and the Alliance's strong reputation in their current health information technology infrastructure. And now, due to that partnership, we have 37 of our 45 health center members part of the HCCN partnership with the Alliance. And, you know, at the beginning of this call, I really enjoyed seeing the one word some of you would use to describe your HCCN and PCA partnership. And if you were to ask me what one word describes our partnership, I would say effective. And I think it's been a common theme on this call that we are all stronger together when we work together. But at the end of the day, you know, I really care, and our members care about results and outcomes, and we've certainly seen those as we've worked together. So let's fast forward to now and discuss how we've been able to leverage our partnership together. Some of the other PCAs is they would consider themselves strong in advocacy. That's a strength of their PCA, and I would consider us in a similar position. And we have a lot of support from our governor's office and elected officials. And one recent example of that is working with the Illinois General Assembly this past weekend to secure an additional $240 million in funding for community health centers, including a $50 million increase to FQHC PPS rates. But our relationship has also led to our PCA announcing a partnership with the governor of Illinois to expand COVID-19 testing statewide through our vast network of health centers. And to date, there are 130 health center testing sites that have tested more than 150,000 individuals in Illinois. And we got that off the ground and running, but shortly after we began testing, we decided we wanted to get FQHC specific testing data, since the state's data was inclusive of all entities that were testing and not just FQHCs. So I spoke with Fred, and I got to see the data that they were collecting, and now we're working together on gathering better data to identify areas of spread and the rate of exposure, case containment, identifying supply needs, and developing practices and tools to protect our patients. And I will tell you that since health centers are serving the areas that are disproportionately impacted by COVID-19, this data and information is extremely valuable to our members, extremely valuable to policymakers, and it can be used for future advocacy efforts and current advocacy efforts. We would not be able to do this without our partnership with Alliance Chicago. Another recent example of our partnership pertains to telehealth infrastructure, and Aaron kind of touched on this. Illinois, like many other states, have rapidly expanded the use of telehealth in response to this pandemic, and we quickly realized that some of our health centers already had the telehealth infrastructure in place, while others were just getting started. So we've been able to work with the Alliance to establish the necessary telemedicine infrastructure for many health centers, and that includes helping them choose their telehealth platform, IT equipment, and identifying telehealth goals and also workflow assistance. We're also able to leverage our partnership with the Alliance to offer reimbursement and discounts on telehealth platforms, which I know our members really appreciate. So I said I'd be brief. In closing, I would just say the relationship and partnership between our organizations has proved to be extremely valuable for our PCA, but more importantly for our health center members. So thank you again for the opportunity to speak this afternoon.
Thank you, Jordan. We appreciate everything that you're doing in Illinois, your leadership in Illinois, and most importantly, the partnership that you have been forging with Fred and Alliance Chicago. So I'd like to thank all of our speakers on today's panel. What a phenomenal job, what phenomenal leadership. The experience that we have brought together today is a testament to how we can fight a pandemic that 6 to 9 months ago we did not think ever would exist. And now as we move beyond COVID, hopefully to whatever a new normal is, we'll be able to work together, forge partnerships, build collaboration, and we hope together we can fight whatever the next pandemic comes. We're all ready. So more to come. Hopefully we will have more webinar series in the future. We're looking for topics. So please fill out the survey at the end of today's webinar, and we will be hearing from you shortly. We hope everybody has a great day. And on behalf of Alliance Chicago and Health Choice Network, we thank you. You are our healthcare heroes. I hope everybody has a fantastic day.